Hello, friends. Welcome to the first TA Live of the year. Whoop, whoop. We're so excited to have you here with us. We are recording today's session so that you can go back and look at it if you need to refer back to it. So let's get started. So this is our first technical assistance live TA Live session of the year. We are talking about functional listening assessments, everyone's favorite, we know. We are joined today by our friends from the University of Miami, and I'm going to hand it over to them. Hi, Lynn.
Hello. Well, we are excited to kick off the TA Live year. We are honored. I know our colleague Jordan McNair, who's going to be the star of our show, will be logging in momentarily. I am going to share my screen and just get started with a little background, and then we will kick it off. All right. Do we have screen share? Thumbs up? Awesome. All right. So today, Dr. McNair is going to take you on an exploration of the functional listening universe. I know that you will find it fascinating and really functional for the kids and students that you work with.
Hi there.
Hey, Jordan. I'm just going to introduce you. I've got a couple slides and then I'm turning it over
Great.
to you.
Thanks, Lynn.
Oh, thank you. If you want to flip the share to you, to the screen share, let me know and I'll stop sharing. If not, I can flip the slides for you, whatever you prefer.
Okay, I'm going to pull it up so I can see my notes and I'll let you know.
Okay, sounds good. So for everybody, I'm Lynn Miskiel and I'm a speech pathologist, audiologist, and listening and spoken language specialist at the University of Miami Devi Institute. The director of the Institute is here, Kathy Vergara. Hi, Kathy. she's in the group. And then, of course,
Hi.
Yeah, awesome. Hi, Kathy. Dr. McNair is joining us from another part of the University of Miami, from the Department of Otolaryngology. He's an assistant professor in the Children's Hearing Program. He is an audiologist extraordinaire. He's a very special combination of a traditional clinical audiologist, but also has been coming to our Devi School Auditory Oral program as our educational audiologist. So he really brings a unique skill set with both these perspectives, and it really has, I think, helped all of us be better at what we do in our educational settings. And we're excited for him to share that perspective with functional listening. I'm not going to go through kind of our structure, where Kathy and I work, what we'd like to do. If you all can join us with the Tea for the Teachers next week, we'll go into a little bit more depth of some of the IDEA state-funded projects that can provide support for you in a number of these different areas. So join us for the Tea with the Teachers. But today we really want to have the time to focus on really learning about these objectives. So Jordan's really going to focus on defining functional listening, naming a variety of functional listening assessments, and then really implementing these assessments effectively. So I will turn it over to Jordan. Jordan, do you want to share your own screen, or you want me to click for the slides?
I'm gonna share my own.
Okay, perfect. I'm going to stop
just
share.
get that set up now.
Okie dokie. But
Okay.
if you want your notes.
What about now?
Perfect. You got it.
Okay, great.
All right. I'm going to be quiet now.
All right, just give me 1 second to make my screen a little smaller and then I'll start. So thank you for that introduction, Lynn. I'm excited to talk with all of you. Like Lynn said, I'm an audiologist by training, and I've learned a lot over the last few years about differences and sort of interprofessional collaboration with deaf educators and with teachers and speech language pathologists and auditory verbal therapists. So I'm knowledgeable on lots of these evaluations, but I'm always really interested to hear from the people who might use them differently than me. So if anyone has any feedback or uses any of these measures differently, please feel free to highlight that in our discussion. So, I first like to talk about like what really is functional listening, right? Because functional listening is a very general term and it can mean a lot of different things to a lot of different people. So, very simply put, it's how a person listens and processes sounds in natural environments. This can be done via a formal or informal assessment, and it can be done in lots of different types of environments. Like I said, it's a very broad term that encompasses how a person listens, processes sounds in those natural environments. And again, it might have different meanings depending on if I'm describing it or if one of our teachers or speech language pathologist is talking about it. So from my perspective as a clinical pediatric audiologist, functional testing to us means with devices in a sound booth. This can occur with speech and noise stimulus or a combination of the two with the patient's hearing devices on. And this might be completed in a variety of configurations regarding the stimulus and also regarding the patient's devices. This is all going to depend on, how much hearing loss does the patient have? Is it 1 year or 2 years? Is it symmetric or not? To an educator or a speech therapist, this term might have a different meaning. So this might be a speech and language assessment with devices on that's in a clinical setting, or a more realistically in a classroom or an area where that student is going to be learning. These assessments range in formality from a simple Ling 6 listening check could be considered functional listening to a very controlled environment like a sound booth with a calibrated stimulus to a certain decibel level. Like I said, this term really encompasses a range of evaluations from questionnaires that might be filled out by a caregiver or teacher to a full functional listening evaluation with technology on in the classroom to help assess benefit with the devices. Though the setup and administration of these evaluations may differ, the information that they can provide regarding a child's functional listening can all impact our clinical decision-making and our assistive listening device decision-making. So I really don't think that any type of evaluation is more important than another. I think what's important is that we all understand how our goals might either overlap or even be a little bit different. My goal as an audiologist, or what I expect as an audiologist in the sound booth, is going to be different than what you might expect or how you would think they would perform in a classroom. So, functional listening evaluations and audiologic perspective. And sorry if you guys hear thunder, it's storming pretty bad over by me. So as an audiologist, we might complete a functional listening evaluation or test in a sound booth, which again is a very controlled environment. This is an example of a test that we as an audiologist might complete with hearing aids on or a cochlear implant on. And what we're looking at is the patient's ability to repeat back single words. This can be scored by word correct or phoneme correct. We use scores on this test to determine CI candidacy for patients. Obviously, we only use this with patients who have the appropriate language to do so. So basically, we work with our speech language pathology partners and with our own knowledge of speech and language development as audiologists to decide what's developmentally appropriate for this. Now, where this might differ or there might be different thought processes is should we test a child that is in hearing aids that needs cochlear implants with this, because they're going to make articulation errors that we're going to mark incorrect. But at the end of the day, we want to mark those articulation errors incorrect on a test based on audiology, because their lack of ability to produce those different phonemes is a direct reflection oftentimes of their hearing loss. So if we don't mark those wrong as audiologists, then we're not going to be qualifying patients who need cochlear implants for that. So for us, if you see an audiology note that says functional testing, we're often talking about doing testing with sentences or words in a calibrated sound booth. Similarly, this is just another example of a test that we might do that's a speech and noise test. And for this one, we're actually having them to repeat sentences. We can start this when it's normed for typically developing children to start in kindergarten. So sometimes with hearing loss, we have to wait a little bit longer to do this one. But essentially, you can see we score it by scoring how many words correct they get of those highlighted prominent words in the sentence. For this is a really helpful test actually for decision making for hearing assistive technology, because in contrast to most tests that we all use, this is not a test that's scored based on percent correct. This test is scored to determine what is that patient's signal to noise ratio. So it basically is looking at when do they get 50% of these words in a sentence correct. When we decide that, there are recommendations in our key for this testing that point out what type of support a child with that performance might need. So this is super helpful with us with deciding on what to recommend for patients to talk to their educational audiologist or the schools about, because we see some children that have appropriate intervention that still have a very poor signal to noise ratio, which is why things like FM, DM, and remote microphones are so important and vital for student success. So, terminology. What is a functional listening assessment? This was kind of more of a hot topic last year, but basically, for lots of years, I think people were kind of throwing around FLE or FLA in unison or as one word, but really a functional listening assessment is a more broad term than an FLE. The FLE is the test from Phonak that is a functional listening assessment, but I think since they're so close in their wording, that sometimes people think that the FLE is the only way to functionally assess listening in the classroom. So it's described in this subsection here that's linked. A functional listening assessment is an assessment that determines how noise, distance, and visual input affect a student's listening abilities. So the definition from the RMTC is very general, and it allows room for a significant interpretation. Based on this definition, an FLA can be a variety of things, ranging from a scored listening task to a questionnaire that's filled out by parents or teachers. And there's many formal assessments involve students repeating sentences or words in background noise in a classroom setting. This makes the assessment, in my opinion, more functional when compared to testing that we might complete as audiologists. So when we're completing similar types of testing in a sound booth, again, there's no chance for any external noise. But if we complete this in a classroom setting, we're taking into account the poor acoustics that are going to be there versus a sound booth, and also external noise factors, like someone might walk into the room, there might be a computer fan that's on. So things that really might happen in a classroom are going to also impact some functional listening assessments that are completed in classrooms. Again, I'm pointing this out to say that the definition that I learned when I was training is much different than this. So I think it's important for us all to understand that it's not necessarily that we disagree on what it is. It's just that the focus of our training is likely different. And the focus of what we learned to do to functionally assess someone is also different. So I definitely had to adjust when I was becoming more prominent in the school setting to think about the function at school versus the function when I have someone in a sound booth. Again, this is directly from the rule. This assessment can be conducted by a teacher of the deaf or hard of hearing or a licensed speech language pathologist knowledgeable in the area of deaf or hard of hearing, as seen in this rule that's linked here. So I think it's interesting to me, this point, that, that audiologist is actually, funny enough, not included in who can conduct the assessment, because a lot of the tests that are used as functional listening assessments and questionnaires are created by audiologists, and they're actually audiologic validation measures that we can use with patients to determine their functional ability with their devices. So I think, in my opinion, an audiologist is also qualified to complete these type of testing, because it's very standard that we would learn about how to use these measures when we're in our graduate training. And then if you ever have any outside placements in the educational setting, you'll get hands-on experience with that. So in our setup at the Debbie School, Lynn and I complete this task sort of together. Though audiologists aren't listed as providers, like I said on the list, they're definitely qualified to complete this type of exam. Educational audiologists who work in the school systems sometimes complete functional listening assessments or evaluations to confirm or validate appropriate performance with devices or to make decisions on hearing assistive technology. So I wanted to take a moment here if there are either questions in the chat or if there are some thoughts based on these two questions that I have here. So the two questions that I have posed here are, which type of instruments are you guys using, meaning questionnaires or assessments to functionally assess students? And then what sort of challenging situations have you encountered? And I'll do my best to answer questions again. I know a good amount about this topic, but I by no means consider myself an expert in the area of educational audiology. It's something I'm passionate about, but always more to learn. So I'll do my best to answer the questions. Let's see. Lynn, if could you help me with maybe?
Yeah, there's no questions in the chat at this point. For the participants, feel free to raise your hand and we'll answer for a minute. It does look like people generally are using the functional listening evaluation. There's two people who have said that. So Ruth Sierra is asking if she heard correctly that an educational audiologist can complete the FLE. I'd like not by the way the eligibility rule is written, but we can do it in collaboration with our speech pathologist or teacher of the deaf.
Right. So based on that rule, no. Based on, I think, education and ability, yes.
We did talk about that when the rule was being created this time, but it was definitely focused for the teachers of the deaf and or speech pathologists to do. But we really recommend, if you have opportunities to involve your educational audiologists, definitely the collaboration with Jordan and I has been fabulous and provides different insights. So it's highly recommended if you have that opportunity. Let's see, a challenge that Corey has been having is completing the functional listening assessment for students that are prelingual or have limited language, having to determine eligibility based on observational data that's collected. I think, Jordan, you're going to talk about some of those challenges and some opportunities.
Yeah. So I'll address that now. I think the beauty behind the generalization, so to speak, of this rule is that there are lots of resources that I think are underutilized by lots of us, by myself included. I think since there was such a focus on FLE, and on doing that functional listening evaluation, that there were lots of questionnaires and things that could also be used to functionally assess that maybe weren't used. And lots of those don't require the patient to actually verbally repeat anything back. They can fill out a questionnaire, or you can fill out the questionnaire with them. They could even technically do that with a sign language interpreter. And they can focus on some of those things that are still going to impact their learning. So I think that those challenges are definitely even challenging for audiologists when we're trying to functionally evaluate. But I think there's two things that you can do. You can focus on some parent or teacher questionnaires in those cases. And then also remember that there can be quality of life improvements with devices, even if we can't functionally prove that with them repeating words or sentences back. So there's lots of questionnaires that I think can be used to show that the devices are working or helping in some way to help support that notion. But I'm going to talk about some of the tools in the next few slides. But if more questions come up, then please feel free to chime in the chat. So, types of functional listening assessments. So these are largely dependent on the age of the child. Again, I've talked about how they can be informal versus formal. This could be a simple listening check versus a very formalized assessment. It could be a questionnaire. It could be a functional evaluation like the FLE, or you can use a combination of multiple methods to get different perspectives. Or you can use the same questionnaire on a parent and a teacher to see about the difference in perspectives there. So I'm just highlighting a few here, right? This is not an exhaustive list. This is just a few that I'm going to go over today. We have the parent's evaluation of oral and oral performance of children. That's referred to as the PEACH. This can be completed from birth to 4 years old and is based on parent observations. the Children's Home Inventory for Listening Difficulties is an inventory of behaviors that are scored by either parent or children ages 3 and up, or by children 8 and up scoring themselves. So there's a parent version and a child version. I think that's a common thing with these questionnaires, that there's usually adapted versions for parent versus self, or that there's ones for younger and older children. The sifter is the screening instrument for targeting educational risks. This is one that I think some schools are using. It's a screening instrument that can be used from pre-K through high school, depending on the version, and it's completed based on teacher observations. The FLE, I think we know pretty well, is a functional assessment using sentences and phrases with and without background noise to objectively assess performance for children 6 years and older. Obviously, that one's going to require the children to have some language. So if they don't, you might want to go a different route. And then lastly, one that I wasn't super familiar with before I looked through the list of resources that the RMTC provides is the Vanderbilt Fatigue Scales. This is a very simple questionnaire that assesses listening fatigue in patients via self-report in children as young as 6 years old. And it can be assessed in adults or older children via the adult version. So I like to go ahead and show some of these for people who have not seen them. But this one is the Peach. Again, this can be completed 4 years and up, and is completed based on parent observations. So if you look at some of these questions, I think when we're deciding on which ones to use, we need to think about, are we the one completing this, or are we asking someone else to complete it? I think admittedly, lots of these tests, like I said, are created by audiologists or audiology researchers. And admittedly, we can be a little bit verbose in our wording sometimes. And sometimes I think that makes the documents feel daunting when you're selecting a questionnaire to have a teacher or a parent fill out. The reason I really like this one is because the questions are simple and the layout is easy. So if you hand someone this, they're not going to feel super overwhelmed with completing this, and they're going to be able to complete it pretty quickly. A couple of the questions that I really like is, how often does your child initiate or participate in conversation? I like that it splits these questions into quiet and noisy situations, because we find that children their performance degrades in noise. So I think it's important when we're asking about their abilities in this area to split those up. And I think some of those questions in noise could be really helpful in deciding on the implementation of hearing assisted technology, because we know that helps to improve signal to noise ratio, which improves speech and noise performance for children. Next, we have the child here. And again, it's an inventory of behaviors that are scored by either the parent of children ages 3 and up, or by children scoring themselves if they're 8 and up. There's a parent and child version. So again, there's some example listening situations here. I think this one takes a little bit more time because it's very situational. It might require a little bit more work on the parent's part, but I do think that there are some value in these two, or these questionnaires that allow for that transition from parent observation to more of students scoring themselves, because I think it starts to help promote self-advocacy for students. Lastly, we have here the Vanderbilt Fatigue Scale, which is another questionnaire that I like pretty well. When I actually completed this on some of the Debbie School children, some of the wording I thought for the age that they say can complete this, some of the wording seemed to confuse some of our kids. So I tried to figure out a way to explain if they had questions, though obviously that is not how we're supposed to use validated measures, but we also know that sometimes kids with hearing loss just don't have that same skill set as early. So sometimes we have to adjust. I like this one also because it's very simple. It's very aesthetically easy to look at. And I think it's highlighting an area that we talk about a lot, but we don't often assess. I think as audiologists and as any professional who works with children with hearing loss, we talk a lot about listening fatigue and what the signs are, but I don't know of other measures that really assess it. So I really liked seeing that this measure was available, because I think it's an area that can be invisible, or it can be seen as just moody or tired after school, when it really could just be due to that cognitive overload that lots of our kids face. I like that this one is done via self-report, but that can also be a challenge. And then I like that this can also transition to older children. So when they're in high school or even later in college and as adults, they can continue to fill out measures like this to see if, a change in intervention has improved their listening fatigue. So we utilize a combination of a lot of these methods. On the kids who can do it, we do also complete the functional listening evaluation. These are some photos from the instructions. So at the Debbie School, like I said, Lynn and I utilized the FLE, which was published by the hearing aid company Phonak. We utilize it with and without assistant listening devices to help assess the benefit of the device alone versus FM or remote microphone or DM system. It's pretty flexible because this evaluation can be done in different conditions with different distances, different noise types. Sometimes we find that these conditions have to be completed in different sessions due to patient fatigue. So at the end of testing or when we're adding noise in, children start to kind of like doze off or really get their attention in a whole different place. So sometimes we choose to complete them, in the same classroom, in the same distance and things, but on a different day. The limitation to this type of testing is that it can be very fatiguing to younger children. So we know that if we're incorporating noise and things like that kids are going to degrade and fatigue when we ask them to do something that's cognitively challenging. Scoring can also be influenced by articulation errors. So depending on who's scoring this, it can be difficult to sparse out whether or not there's a true articulation error or if the incorrect response was related to developmental age or lack of auditory access. So let's see if I think my videos are not going to play, but that's okay. I had a couple videos of our students that were completing the functional listening evaluations in our classroom. And they were super cute, but it's okay that they're not playing. Basically, I was trying to demonstrate that the difference in conditions where we're completing this close, far, and with and without visual cues and with and without background noise. We personally use like cafeteria or classroom noise. And then we use a sound level meter on the phone or from our clinic in the audiology space to help calibrate that level, at least generally. It's not as specific as like calibrating in a sound booth, but we do try to calibrate it as instructed by that FLE manual to make sure that our noise is pretty consistent.
Jordan, can I jump in? It was interesting in the chat, someone mentioned that they sometimes have difficulty finding an appropriate room to administer the FLE. In the chat, I reflected that maybe that's good, that maybe they want to actually do the FLE in that more challenging environment where the child is actually learning. And I know that you talked about that just now, where to actually administer it.
Yeah, no, I think that's the beauty of the functional listening assessments and evaluations is that the instructions are somewhat loose for most of them. I think obviously we don't change the questions on the questionnaire type ones, but with the FLE specifically, there's lots of gray area in the instructions, I think on purpose, because I think they were trying to contrast the type of testing that we typically do in audiology to really make it functional. So it's never going to be the same from school to school or classroom to classroom, but if it's already a challenging listening environment, you could try to see, can you just do it in quiet and see if that student or can you do it without any additional background noise and almost utilize the background noise that might be present as your noise. Obviously, you probably can't calibrate that as well, but that's probably the most functional type of evaluation you could do and realistic. And even if you don't necessarily use it for your eval that you're completing, it might still provide some insight on difficulties for that specific student or that specific classroom. It might also be an interesting idea to do it if you have a student who performs well when you're doing your FLE in like a more controlled environment, but the teacher's observations or parent observations don't match their performance there. You could try to go do it in a classroom that maybe has different acoustics or different types of noise. And that might be the reason why, because I think it's difficult, but acoustics really do affect the transmission of sound, I think, more than we like to think on a day-to-day basis. So if you're doing it in a classroom or a space that's much different than where they're actually usually learning, that can also be influence or explain the reasoning for differences in results. For like longitudinal comparison, I try to do it in the same classroom for the ones that I want to look at as they get older. But that is an interesting thing to think about, that if I could also veer off and do some in some different environments just to see if there's differences, and I could kind of look at those and compare those. So what types of information do these evaluations or assessments provide? So a lot of them, like I said earlier, I learned them as audiologic validation measures. So we verify hearing aids with a VeriFit. At least everyone should be, especially for kids. That's a soapbox that's for a different presentation, but audiologists should be taking care of the verification part, whether that's the clinical audiologist. They should have no excuse not to. And then educational, hopefully the district that the educational audiologists work in have VeriFit. If not, again, the clinical audiologist should have verified fit prior to involvement of the school. So we have verification, and then we have validation, which is more of a functional assessment of the devices working. So that's the first type of information it can provide. It can provide information about the benefit or lack of benefit with devices alone. It can provide information about benefit or lack of benefit with an FM system, DM system, or remote microphone. It can also help in decision-making for hearing assistive technology, and it can help to encourage parents and teachers to utilize assistive listening technology or hearing technology more consistently. I think for whatever reason, there are sometimes teachers or there are sometimes parents who don't see the value in this. What I try to do for myself, I'm lucky at the Debbie School that the teachers see the value before I even have to prove it to them, but I try to connect kids for the first time right in front of teachers or right in front of parents if I can when I'm in audiology clinic, because that first reaction that you get from a kid that's never been connected before is usually enough for whoever is responsible for connecting to want to do it every time. It's very rare, unless there's a kid with sensory issues or other issues, that children don't benefit from these devices. Our children that don't have any sensory issues or concerns for volume, they love when we connect them, and they seek us out to tell us that they're not connected or that they want to be connected. So for me, anecdotally and based on the research, if a child has hearing loss, we know that an FM system is not going to be harmful to them. One thing I wanted to highlight is the RMTC-DHH website. This is a tab that I have flagged for myself, because if you go to the resources tab and then to assessments and evaluations and scroll down to the available assessment tools, then to functional listening assessments, it talks about some of the information I highlighted in the beginning of this presentation, but it also has a really nice table with ages and links to a lot of those questionnaires. So that's the difficult thing too, is that when we're using new things, sometimes that's our excuse, right? Is that, oh, we don't have access to them or we can't access that. But they've done a really nice job at organizing already for us with the age groups and with the evaluations, even in different languages. So in some of these, it's nice that we could, especially in the area that we serve, there's a lot of Spanish speaking patients. So there's lots of these questionnaires and things that are available in Spanish, especially if it's a parent questionnaire. The child might be leaning towards bilingual, but the parents might still be a monolingual Spanish household primarily. So it's important that we can still get their input, even though we don't necessarily all share that same language. We can help either with interpretation or some service to help provide that in their home language so that they feel comfortable. And then I have just a cute picture of some of our kids here. Questions. Thank you guys for attending. This is one of our favorite little pictures that we have of our kids here at the end. This class was very close and are all good friends, and some of them are still at the Debbie School. And then I'll leave this up in case anyone wants to take down contact information or emails, and we'll open it up for questions, or if there's questions in the chat, we can address those now too.
While we may be waiting for some other questions to come in, to expand a little bit on that articulation issue that Jordan mentioned, it was a question in the chat also, and that is definitely a challenge both for audiologists when they're testing discreetly in the booth, and for us when we're doing functional listening with an imitation task. One thing as a speech language pathologist, what we kind of look for is the shape of a word. So does the child produce the right number of syllables with perhaps the right vowel or at least one of the consonants correct, so that we can give them credit for getting the language and the imitation, even if their articulation isn't clear. So sometimes that's a criteria that we can use. We do that sometimes if we're looking at expressive vocabulary and trying to sort that out and not have the articulation reduce their actual ability to produce the language. So that can help with some of our functional listening evaluation with the FLE and with other assessments, is giving at least a criteria so that you're framing how you're going to give credit for an articulation error versus, again, as Jordan said, is it in fact that they're not hearing it properly, or can they just not say it properly? There's a question specifically for the FLE. Is there a recommendation for how frequently it should be assessed?
I would have to look in the article to see if there's a recommended on frequency, but I would say obviously if there's been a change in hearing technology or hearing sensitivity, it should be reassessed. And then, I think you could probably argue that as children develop year by year, or even in 6-month increments, that their development might make them just perform better on that too. But I would have to look to see if there's any recommendation in the beginning of that verbiage where they're explaining the background of it.
I know sometimes I go to what is the question that we're answering with the tool. So we know, of course, for initial eligibility, for really evaluating, does a child need a DM or FM system, some kind of hearing assistive technology, the FLE specifically, or whatever FLA you're using is a great tool. But again, like Jordan said, if there's a change, what question are we answering by administering whatever FLA you're doing at that moment? And that's where an FLE is going to have a place, but some of the questionnaires, Jordan was experimenting with fatigue rating, really looking at our kids who really have great skills, but are they demonstrating auditory fatigue? Do they reflect on auditory fatigue? So that has a different purpose than a classic functional listening evaluation.
I agree. And I see some more questions.
Frequency.
I think with the correct or not, to my knowledge in reading it, there isn't very explicit instruction on how to mark it correct or incorrect. So I think the important thing is that you're being consistent. So if you're the one that's doing them, or you have a team of people doing them, I think you have to agree upon how you're scoring them. I think for me personally, being an audiologist, it's sometimes hard for me to separate how we score our tests in audiology versus this, because it's more gray. And some of the way that we score tests in audiology is much more black and white. So that is a difficulty that I find, but I just find that I have to make sure and hold myself accountable at being very consistent when I'm scoring. So making sure that I'm scoring from like subject to subject and within subject very consistently when I'm completing them. And if I encounter a way that I'm scoring or something marked correct, I sometimes will write down like, oh, I'm counting that right, so that I make sure that I continue to do it, or that I do it for other children too.
And that's where that kind of framework for articulation comes in also, that we have a framework of if they produce that, the correct number of syllables and at least one of the consonants correctly, to give them credit. That, again, whatever you decide, but that consistency is so important.
I sometimes will keep an eye on frequency of error too. So for example, if a child is doing well but consistently mispronouncing the R, I'm probably not going to keep marking those words wrong, because obviously there's an articulation component that, whether or not it's related or developmentally appropriate, it's not just I think when the errors are more random and they can't be explained either by development or relate to hearing loss, then I'm more prone to marking them wrong, because I think that they're errors. But I think if there's obvious patterns to the errors, they're probably things that are being worked on in speech that they're actively trying to improve, but that are still giving them difficulty. So obviously, I don't think we need to, transcribe the sample, the speech sample, but I think looking and seeing like, oh, is every error they made the same? And then you could potentially consult with someone who's working with them on their speech to see like, is this a common error for them, or is this something you're seeing? And you could even score with and without counting that wrong to see if there's even that much of a difference. You could do things like that. I think the beauty in it is the grayness, which is also a challenge for me. But I think you can do it different ways and look at it different ways because, we have that creative freedom. For the requirement, I don't know if there's a requirement for two people. I find it easier. I don't think that there is a requirement. But I do think that sometimes if you're doing it on children that are at that age cutoff, that it is sometimes easier to have someone that's also keeping the child redirected, especially when you're not close to them. So when you're doing it very close, it's very easy to also redirect the child. But if you're doing some of those more distant conditions, the child might have a tendency to veer off into space a little bit more than if you're right next to them. So sometimes I'll have a trainee come over with me and either serve in the role as being the speaker or just sitting by the child to keep them in the chair. Any other questions? And if you don't have them now, but you want to email us, we're happy to try to answer them to the best of our abilities. I'm going to go ahead and stop sharing.
We really appreciate all the input. Again, with the eligibility changes in the eligibility rule, it opened the door for us to have a lot more versatility. And again, going back to thinking about function so that we're not locked into the functional listening evaluation specifically, but really can incorporate this range, which assists us with many of the questions which are related to our Deaf Plus kids and articulation concerns, but then also brings us the opportunity to look at different aspects of functional listening that aren't just that repeating back sentences in different environments, like their self-perception of their skill sets and that fatigue rating scale, which I find kind of interesting.
I don't
Thanks,
see any more.
everyone.
Yeah, I don't see any more questions in the chat. Jordan, Lynn, thank you guys so much for sharing your wealth of knowledge. Oh my goodness, that was so amazing. I'm so thankful to have y'all here and that this is being recorded and everything. So thank y'all for being here and for presenting your knowledge. We're so thankful. So that was this month. Next month, we have Dr. Leslie Walker from Miami-Dade County Public Schools, and she will be talking about hearing assisted technology. And I see her on the line right now, so I'm excited.
Hi, Leslie.
For her. She'll be talking with us on hearing assisted technology next month. That will be October 15th, 2025. I know my years, kind of. And we are going to throw in the chat the evaluation. If you could give us your feedback is important to us. We listen to all of your feedback. We are a IDEA funded state project out of the Florida Department of Education and Bureau of Exceptional Education and Student Services. And all of our services that we provide are free. So if you can give us feedback on today's session and any other kind of sessions you want to see like this, by all means, please do. I'll give a little bit of time for anyone who wants the QR code for that. And then once you are done with your evaluation, you can also get a certificate of completion for 1 hour for today's session. And you can type in for today's session's TA Live functional listening assessments. And we're going to throw that in the chat as well. Again, thank you all for joining us today. We're so excited that this was our first TA Live of the year and we kicked it off with a bang. So it was awesome. Thank you, Jordan. Thank you, Lynn. Thank you to our interpreter, Laura from AI Media. We're so grateful to have her here today with us as well. And you all are free to go.
Thank you. Have a great one, everyone. Thanks for having us.
Thank you.
Thank you, everyone.